Good morning, all of you that are watching. I'm sure you're saying, what is this video all about? This video is about a new non-invasive system that a good friend of mine introduced me to. And if you are in the medical field, if you are a doctor, if you're a health practitioner, this is a system that is well recommended by different um, organizations such as the JDRF, the American Heart Association, American Diabetes Association, the National Heart, Lung, and Blood Institute, the American Academy of Neurology, American Academy of Family Physicians, the also the American Association of Clinical Endocrinologists. It's a system that is FDA approved, and it's a non-invasive system that in 15 minutes you'll be able to identify your patients if they're at risk for sudden death, silent heart attacks, hypertension, cardiac autonomic, neuropathy, diabetic automatic neuropathy, vascular abnormalities, orthostatistics, hypotension, syncope, and other hidden diseases. Testing of the sympathetic and parasympathetic nervous system is a recommended standard of the care of the American Diabetes Association for patients with type 1 and type 2 diabetes. Now, normally this system usually costs anywhere from $50,000 to $150,000 just to acquire it or purchase it. Through the Vital System program, we'll make it available to you absolutely free. You heard it, free. So that way you can be able to bill your patient, be they private or public, directly. And this way, be able to use a system that can save lives, your patients' lives. This is a non-invasive system, like I mentioned. It's automatic balance analysis, pulse wave velocity analysis, arterial vascular assessment, peripheral arterial index, ankle brachial index, pulse volume recording. It also has a HRV stress index, HRV analysis, sweat glands analysis, valsalvation, historical data. This is really the future of the healthcare system for the nervous and vascular system testing. It's definitely it provides comprehensive and fully automated nervous and vascular testing equipment that is very useful to gauge their patient's health and uncover hidden diseases. For if you're in the healthcare industry, this system is a need to have in your office. Testing for the nervous and vascular system can identify clinical disorders, uncover major illness and other hidden diseases such as sudden death, silent heart attack, hypertension, cardiac autonomic and neuropathy, vascular abnormalities, as I mentioned, and orthopathic hypertension, and syncope. The physicians will benefit off of this system. Its assessments are a valuable tool in diagnosing hidden illnesses, having the ability to test patients quickly and easily and receive immediate comprehensive interpretive reports after the test it's completely invaluable to the medical practitioner. The benefits for the office, for the health facilitators assessments are numerous, including number one, test taking only takes about 15 minutes to run a full battery of tests. The individual test modules takes as little as 6 to 10 minutes. The interpretive reports are generated immediately after the testing, and the reports are very easy to read and understand. Includes additional details and graph options for the physician. That's not all. The test can also help your patients. Have you recently been informed that the hospital or perhaps the clinic should begin administering these tests? Are you aware that healthcare guidelines that requires a care path for your patients? Nervous and vascular system testing is designed to best evaluate your patient's bodily function and plays an important role in investigating those who suffer from various diseases. These are not invasive tests or potentially harmful procedures involved. And often a single exam lasts less than a half an hour and can be performed by a medical assistant. The comprehensive report is also interpreted. In other words, it's a very easy to use for any of the facilities that are dealing with patients, even older homes or elder home care. Perfect for this type of environment. This test also involves 4 separate procedures. each of which is designed to determine a particular aspect of your patient's nervous and vascular system. There are four portions: the resting phase, the heart rate during the breathing, the what they call the HRDB test, the Valsalva test, the standing test, and more. Please, if this is something of interest to you in your health facility, contact me immediately at 786 306 8211. That's 786 306 8211. Now, why should patients and you, the medical facilitator, should have this? According to published studies, the cardiovascular autonomic neuropathy occurs in about 17% of patients with type 1 diabetes and about 22% with type 2 diabetes. Of patients with symptomatic autonomic dysfunction, about 25% to 50% die within 1 to 5 years of diagnosis. A patient's history and physical examinations are ineffective for early detections of CAN, and therefore non-invasive tests that have demonstrated the efficacy are required. Screening or autonomic neuropathy should be instituted at the diagnosis of type 2 diabetes and 5 years after the diagnosis of type 1 diabetes. This according to the American Diabetes Standard of Diabetic Care. Although it can cause severe cardiovascular problems and sudden death, surveys show that only 2% of the people with diabetes are tested for cardiovascular autonomic neuropathy, or CAN. This feature of this test provides certain benefits to the medical professional and the health facilitator. Easily adaptable towards general and specific requirements of almost all medical branches. Presents a quick and reliable supplementary assessment of basic health risk factors. It assesses the balance between the activities of sympathetic and parasympathetic branches of the autonomic nervous system. Reliability discovers ventricular and supraventricular extrasystoles. The assay is also accumulated by HRV stresses. It also reveals developments of possible health risk. It provides early indications of health risk for quick detection and prevention of illness, diseases, and progressive stress conditions before the onset and development. Efficiently screen mass population to detect potential risk, and it also reserves costly and full medical checkups for only those exhibiting health threats. This is a great application, and it helps you, the medical professional, in monitoring current health of the individual patients closely and verifying the efficacy of the current treatment protocol and intervention. And it examines patients for CAN and DAN, cardiac autonomic neuropathy, and diabetic autonomic neuropathy. Now, measuring the metabolic syndrome, the hypertension, heart failure, is also a plus with this system. It also explores the asthma, the COPD, palpitation, the pain management, plus the optimization of treatments for each individual patient. There's an immediate report, qualitative and quantitative, graphic analysis and results of the parasympathetic and the sympathetic cardiovascular stress, and the overall health assessment for comparison with patient case history and the necessary procedures of actions. The efficient patient-centered multiple system treatment management is also a big plus in the system. It involves areas of diabetes, hypertension, obesity, smoking, increasing age, family health history problems. It also involves in the hypercholesterolemia and the hypertriglyceridemia areas. It's also a system that is FDA approved, and like I mentioned before, highly recommended as a monitoring system by the following prestigious organizations as the JDRF, the American Heart Association, the American Diabetes Association, the National Heart, Lung, and Blood Institute, the NIDDK, the American Academy of Family Physicians, and the American Association of Clinical Endocrinologists. It's a comprehensive, non-invasive system, which, as I mentioned, includes the comprehensive autonomic analysis, arterial vascular assessment, the ankle brachial index, the pulse wave velocity, the peripheral arterial disease, the photoelectrical analysis, the K30 and 15, the sweat gland functions, and the sinochronous blood pressure analysis, stiffness index, the peripheral arterial tone assessment, the SpO2, and the Ewing test, and the overall health risk factors. In other words, it's a system that is recommended by most of these great prestigious organizations for the health. Now, you might say, well, this system is going to cost me an arm and a leg. No, in this program with the Vital System Test, this system is absolutely free. We have a written up a partnership agreement in which you bill the insurance, either private or public. We provide you with a medical billing code so you can be able to bill the providers or the insurance providers. And actually, this equipment, although someone wishes to purchase it, it will normally cost anywhere from $50,000 to $150,000. But we know that many of the medical facilities don't have that type of cash availability to be able to acquire such a system, which benefits the patients. So therefore, we created this program where you can partner in and be able to utilize it absolutely free. We'll provide you with a training program with a registered nurse, how to read it, how to use the system. And in addition to that, we will help you set up the whole system in your office. All you need to do right now is give us a call at 786-306-8211 or send me an email to Rabbi, R-A-B-B-I, Otero. Now you may ask, where is this system available? Where can I get it? Is it available in my state? Yes, it's available in all the United States of America. If you have an office, and this is why I'm doing this video for it to go live everywhere, we can make arrangements to make this system available in your office, in your doctor's office, or in your health provider, even for the elder home living facilities, which really is something that's really needed in the event of an emergency to find out how your patients are doing. Any facilities that deal with health issues, nutritional facilities as well, we'll be more than happy to make it available to you and make it where you're not having to pay anything up front. And if you do want to buy it, we can also make that available to you as well. But please give me a call if this is of interest to you. If you're a doctor, if you're in the medical field or your health provider, be more than happy to make the arrangements, to make the contact, to make the connections so you can have this system in your office today. My number again is 786-306-8211, and my email, so I can be able to send to you all of the forms and information that you perhaps are asking, is Rabbi Otero, R-A-B-B-I, Otero, O-T-E-R-O, at yahoo.com. And look forward to hearing from you today. Shalom, shalom.